You just looked, didn't you? Or you're thinking about it right now. And if you're being honest, you've probably never paid close attention to what you actually saw. Most people over 60 haven't, because nobody ever told them they should. Nobody ever told them that what leaves their body every single day is one of the most readable, most available, and most ignored diagnostic tools in all of medicine. Your kidneys filter approximately 200 liters of blood every single day. Everything they catch, everything they process, everything that goes wrong shows up in your urine. Color, clarity, foam, frequency. Your urine is your kidney's daily report card, and after today, you will know how to read it. I have had patients sit across from me with kidney function already significantly compromised, and when I asked about their urine, they described exactly the signs I'm about to show you. Signs they had noticed. Signs they had seen more than once and moved past. Not because they weren't paying attention, because nobody had ever given them a guide. One of my patients, a man in his late 60s, had been watching foam collect in the toilet bowl for over a year. He assumed it was the water pressure. By the time he mentioned it, almost as an aside, the damage was already measurable. A woman I treated noticed her urine had turned faintly pink one morning. She assumed it was the beats she'd had the night before and never mentioned it to anyone. 6 months later, what we found required urgent investigation. Here's what your urine color is actually trying to tell you, and what most seniors never learn to hear. My name is Dr. Sophie Martin. I'm a urologist with over 20 years in clinical practice, and today I'm going to walk you through 7 urine colors and signs, what each one means for your kidney health, how serious each one is, and exactly what to do when you see it. Think of your kidneys the way a mechanic thinks about engine oil. Pull the dipstick on a neglected engine, and the oil tells you everything. The color, the consistency, what's burning inside, what's breaking down. The oil doesn't lie. It reports. Your urine works on exactly the same principle. It is the output of an organ processing 200 liters of blood every day. And when something changes inside, that change shows up in what comes out. Here is what gives urine its normal pale yellow color. A pigment called urochrome, produced when your body breaks down old red blood cells. The more concentrated your urine, the darker the yellow. The more diluted, the paler. But when color changes beyond that range, when foam appears, when red shows up, when the output goes cloudy or stops altogether, something has shifted inside the filtration system that produced it. Here is why this matters specifically for you. According to UCLA Health, up to 40% of adults over 65 are chronically dehydrated, most without ever feeling thirsty, because the thirst mechanism weakens significantly with age. And according to the National Institute of Diabetes and Digestive and Kidney Diseases, as many as 9 in 10 adults with chronic kidney disease have no idea they have it, because early-stage kidney disease produces no symptoms whatsoever. None of what I'm about to show you is a diagnosis. Every one of these signs is a signal. And the difference between catching kidney disease early and catching it late is often nothing more than knowing which signals to look for and taking them seriously when they appear. Sign 1. Dark yellow or deep amber urine, the color of strong tea or apple juice, consistently, not just first thing in the morning. This is your kidneys conserving water because your body is chronically mildly dehydrated. After 60, your thirst mechanism weakens. You won't feel it until the damage is already happening. This is low to moderate urgency. Increase your fluid intake gradually and monitor. Your urine should shift toward pale yellow within 24 to 48 hours. If it doesn't, that warrants a closer look. Sign 2. Consistently pale or completely colorless urine, clear as water throughout the entire day. If you're not drinking unusually large volumes of fluid, this is not a sign of good hydration. It may be an early warning that your kidneys are losing their ability to concentrate urine, one of the first functions to decline in kidney disease. Moderate urgency. Ask your doctor for a GFR and creatinine check. Do not assume pale is always better. Sign 3. Cloudy or murky urine, hazy, opaque, no longer clear. In senior women, this is almost always a urinary tract infection. In senior men, it can involve the prostate. It can also indicate kidney stones beginning to pass. Moderate to high urgency, especially with burning, frequency, or any pelvic discomfort. Contact your doctor within 24 to 48 hours. Do not wait this out. An untreated UTI in a senior can reach the kidneys within days. If you've ever seen cloudy urine and waited to see if it cleared on its own, tell me in the comments. Because that window of waiting is exactly where infections travel upward. Sign 4. Foamy or frothy urine. Not the brief bubbles that vanish immediately, but foam that lingers in the bowl after flushing. That persistent froth is the visual signature of protein escaping through your kidney's filtration membrane. Protein in urine, proteinuria, is one of the earliest detectable signs of kidney damage, and it is almost universally ignored. High urgency. Ask your doctor specifically for a urine albumin to creatinine ratio test. Do not wait for your next annual physical. Sign 5. Orange urine. Not dark yellow, but distinctly orange. 3 possible causes: severe dehydration beyond the dark yellow stage, liver or bile duct involvement, or specific medications including certain antibiotics and laxatives. The distinction matters. I know orange from dehydration resolves within hours of drinking adequate fluids. Orange that persists after a full day of hydration is a liver and kidney warning. Moderate to high urgency. Hydrate immediately. If the color holds, same week doctor appointment. Mention any new medications started in the past month. Most people watching this have never been told that foam in the toilet, not brief bubbles, but foam that stays, is worth a phone call. That single piece of knowledge at the right moment is the difference between catching kidney damage early and discovering it late. Sign 6. Pink, red, or brown urine. Any shade from the faintest rose tint to deep reddish brown. This is blood in the urine. At any level, from any cause. Before you assume it was beets or a new medication, those can cause discoloration, and your doctor must be the one to rule that out. Because blood in the urine can also mean kidney stones, bladder inflammation, or something that must not wait. I have sat with patients who saw this once, dismissed it, and came back months later with something that, caught earlier, would have been far more manageable. High to immediate urgency. Even once. Even faint. Even if it never returns, contact your doctor the same day or the following morning. This sign does not wait well. Sign 7. No urine, or significantly less than usual over several hours, not a color, and absence. When the kidneys go quiet, it is the loudest warning on this entire list. This can mean acute kidney injury, obstruction from a stone or prostate enlargement, medication toxicity, or the beginning of organ failure. This is not a sign to monitor. This is not a sign to research online. If you have produced no meaningful urine in 6 or more hours and are not severely ill from vomiting or fever, go to an emergency department today, not tomorrow, today. Information without a plan is just anxiety. So here is exactly what to do with what you've just learned. Tier 1, dark yellow or colorless urine that responds to hydration within 48 hours. Monitor, adjust your fluid intake, and mention it at your next routine appointment. Tier 2, persistent cloudy urine, foam that lingers, or orange that doesn't resolve after a full day of fluids. These are same-week calls to your doctor. Not an emergency, not next month. This week. Tier 3, any pink, red, or brown urine even once. Any significant drop or complete absence of urine output. These are today's signs, same day. No waiting, no rationalizing. One more thing. If you bring a Tier 2 or Tier 3 sign to your doctor and they dismiss it without ordering a urine test, ask specifically for a urinalysis and a urine albumin to creatinine ratio. A doctor who takes kidney health seriously will not refuse that request. If they do, seek a second opinion. I know that some of what you just heard, particularly those last two signs, carries real weight. That feeling is appropriate. But here is what I need you to hold on to. Kidney disease caught at stage 1 or 2 is highly manageable. Lifestyle changes, medication adjustments, and regular monitoring can preserve kidney function for decades. The tools to catch it have never been more accessible. A urine test and a single blood draw tell the story. And the single most powerful variable in kidney health outcomes is not your age, not your genetics, not your diagnosis. It is how early the conversation happens. The kidney is one of the most resilient organs in the human body. Catch damage early, remove its cause, and the kidney responds. It fights back. And at 60, at 70, at 80, that fight is absolutely worth starting. Let me tell you about Arthur, 72 years old, retired. The kind of man who drove himself to the hardware store every Saturday morning and considered that a productive day. He came to me for a routine follow-up. Nothing urgent, nothing alarming. And near the end of the appointment, almost as an afterthought, he mentioned that his urine had been foamy for several months. His wife had pointed it out. He had dismissed it. He told himself it was the water pressure or the cleaning tablet in the tank or something he'd eaten. I ordered a urine protein test that same afternoon. It came back showing significant proteinuria, early-stage diabetic nephropathy, caught before it had progressed to stage 3 chronic kidney disease. When I explained what we'd found and what we'd almost missed, Arthur was quiet for a moment. Then he said, "I almost became someone my grandkids had to worry about." 12 words, and they have stayed with me ever since. We adjusted his medication. We made targeted dietary changes. His kidney function stabilized. Last I heard from him, he was still driving himself to that hardware store every Saturday morning. One almost afterthought, one urine test, one conversation that happened just in time. Your body has never stopped communicating with you. It communicates every single day, in the most ordinary moments, in the most private spaces, in what it produces and sends away without ceremony. The question was never whether it was speaking. The question was whether anyone had taught you to listen. The first person who sees your urine every morning is you. Not a doctor, not a laboratory, you. That makes you the first line of your own kidney health. Not a burden. A power that most people never claim. You have it now. Use it. 3 things to remember. Dark or pale urine, monitor and adjust your hydration. Cloudy, foamy, or orange. Contact your doctor this week. Pink, red, brown, or no output at all. Act today. Same day. No exceptions. Which of these 7 signs have you seen and dismissed? Tell me in the comments, because your answer might be the reason someone else finally picks up the phone. If someone came to mind while you were watching this, someone who would wave off every sign on this list, share it with them. You don't need to say a word. Just send it. One share might catch something before it becomes something serious. Your kidneys have been working for you every hour of every day for your entire life. They deserve 5 seconds of your attention, starting now. Everything I've shared today is based on published clinical research and over 20 years of patient care, but it is general information, not personal medical advice. Urine color changes have many possible causes, and only a qualified medical professional can evaluate your specific situation. Please use this as a reason to start a conversation with your doctor, not to self-diagnose. That conversation, specific and direct and without delay when it matters, is exactly where good kidney care begins.